Patellofemoral pain syndrome, or runner's knee, is a condition characterized by pain around or beneath the kneecap. It is frequently seen in runners, cyclists, skiers, soccer players, jumpers, and other athletes who place repetitive stress on their knees. The patella, commonly known as the kneecap, is a small triangular bone located at the front of the knee joint. It is embedded within the tendon that connects the thigh muscles to the tibia, or shin bone. The main role of the patella is to protect the front portion of the knee and assist with smooth knee movement. Causes: Patellofemoral pain syndrome can develop due to several different factors. Common causes include improper alignment of the patella, partial or complete kneecap dislocation, overuse injuries, weak or tight thigh muscles, flat feet, or direct injury to the knee. The condition may also result from irritation of the tendons surrounding the knee or softening and damage of the cartilage beneath the patella. In some cases, pain felt in the knee may actually originate from the hip or lower back. Diagnosis: To diagnose patellofemoral pain syndrome, your doctor will discuss your symptoms, medical history, sports activities, and movements that increase your knee pain. A physical examination of the knee will then be performed to evaluate knee motion, alignment, muscle strength, and tenderness. Imaging studies such as X-rays, MRI scans, CT scans, or blood tests may also be ordered to rule out structural problems or other medical conditions affecting the knee. Treatment: Treatment depends on the exact cause of the condition, but most cases can be managed successfully without surgery. Non-surgical treatment: The first step is usually avoiding activities that trigger knee pain, especially running, jumping, or repetitive high-impact movements. RICE protocol. Initial treatment commonly follows the RC method: rest, ice, compression, elevation. This approach helps reduce swelling, inflammation, and discomfort. Non-steroidal anti-inflammatory medications may also be recommended to relieve pain and inflammation. Physical therapy. A physical therapist may create a rehabilitation program focused on strengthening and stretching the muscles around the knee and thigh. Flexibility exercises and low-impact cross-training activities may also be included to improve lower extremity function. Knee taping. Special adhesive tape may be placed around the patella to improve kneecap positioning and movement. Taping can help decrease pain during activity. Knee bracing. A supportive knee brace may be recommended during sports or exercise to stabilize the knee and reduce stress on the patella. Orthotics. For patients with flat feet or abnormal foot mechanics, shoe inserts or orthotics may help improve alignment and decrease pressure on the knee joint. Surgical treatment. If conservative treatment fails to improve symptoms, surgery may be considered. Surgical options include arthroscopy and patella realignment procedures. Arthroscopy. Arthroscopy surgery is performed in the operating room under sterile conditions using either spinal or general anesthesia. The surgeon makes 2 small incisions around the knee. An arthroscope, which is a thin instrument equipped with a tiny camera, is inserted into the joint. The camera projects images onto a monitor, allowing the surgeon to examine the structures inside the knee. A sterile fluid is introduced into the joint to expand the space and improve visibility. Using specialized instruments inserted through additional small incisions, the surgeon can remove damaged cartilage fragments or treat abnormalities inside the knee. Patellar realignment. If the patella is not properly aligned, a realignment procedure may be necessary. This surgery restores the patella to its correct position, reducing abnormal pressure on the cartilage and surrounding tissues. A larger incision is made at the front of the knee to perform this correction. Lateral retinacular release. In some patients, the ligaments on the outer side of the kneecap are excessively tight. These tissues may be surgically released to allow the patella to move more naturally within its groove. The surgeon may also tighten structures on the inner side of the knee to improve kneecap alignment. Tibial tubercle transfer. In severe cases of malalignment, a tibial tubercle transfer procedure may be performed. During this surgery, the portion of bone where the patellar tendon attaches to the tibia is carefully detached and repositioned into a better alignment. The bone is then fixed back into place using screws. After correction, arthroscopy is used again to confirm proper kneecap positioning before the incisions are closed with sutures. Postoperative care. After surgery, pain medications may be prescribed to control discomfort. To reduce swelling, patients are usually advised to elevate the leg and apply ice packs regularly. Crutches may be required for several weeks to reduce weight bearing on the knee. A knee immobilizer or brace may also be used to stabilize the joint during healing. Your doctor or physical therapist will provide instructions regarding safe activities and rehabilitation exercises to help restore strength and mobility. Risks and complications. Although knee surgery is generally safe, certain risks and complications may occur, including bleeding inside the knee joint or hemarthrosis, infection, blood clots or deep vein thrombosis, injury to nerves or blood vessels, ligament damage, knee stiffness, and arthropfibrosis, which is excessive scar tissue formation around the joint. Prevention. Several lifestyle changes and preventive measures may help reduce the risk of developing runner's knee. Maintain a healthy body weight to decrease stress on the knees. Increase exercise intensity gradually. Use shoe inserts if you have flat feet or foot alignment problems. Avoid running on hard surfaces whenever possible. Wear supportive running shoes with good shock absorption. Avoid running directly downhill. Instead, move in a zigzag pattern or walk downhill. Warm up before exercise for at least 5 minutes. Stretch properly after workouts. Runner's knee is one of the most common overuse injuries among athletes, especially runners. However, it can affect anyone who places repetitive stress on the knee joint. If knee pain develops during activity, it is important to seek medical advice early to prevent worsening of the condition.